Welcome. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the September 2nd cross-industry public health call that we restarted last week. As many of you know, I sent out an email saying that the Board of Health is meeting this evening, and Lane's going to do the best job he can to give kind of a preview of what the order might look like that's being presented to the Board of Health. But a reminder, until that order is voted on and actually put into as an order or a law, we won't know the actual details or the final details. So we're going to give you the best sense we can today. We're going to answer your questions, put your questions in the Q&A. It's a lot easier for me to track because we get hundreds of questions on these webinars. So I appreciate everybody doing that, and it's easier for us to get through them as quickly as we can. Without further ado, I'm going to give it to Lane to kind of walk us through.
Thank you, Corinne, and thank you all for joining. I'm going to use that proposed language throughout because this is what's proposed. And as Corinne mentioned, once there's a final adopted order, we will make sure that that gets out to the broader group. I'm hopeful it isn't dramatically different than what I'm sharing with you. But before that, I just want to kind of still walk through where things are at and some of those, again, drivers of why this is being considered. So here's this tracker over time throughout our incident of what we've been dealing with, and kind of, again, comparing across the country. Colorado is really not different than what's been happening nationally, other than maybe this current surge. We're weathering it a little bit better, some of which is based on policy decisions. And so that's kind of where things are at with COVID. Again, seeing this climb. There's been just a very recent drop downward. We're hope that happens, but we're still expecting that even through the fall, that surge is going to go even higher. So I'll show this slide again later on, but this is an important nuance for folks to know. There is no more state COVID dial. So we're really looking at the same types of information, but on a national level, the CDC has their transmission tracker, and it's really looking at those case counts and then looking at the positivity rate. So similar information that we had been showing to you all last year. And where we kind of fall, we are right now, at least on the case counts, are in the very high transmission component, and we're unfortunately seeing our positivity increase, and I've got a slide to show you that as well. But this is pretty much a nuance across all of Colorado. So again, Boulder County doing slightly better than some of our neighboring peers, and then much better than kind of Weld and Larimer counties, some of our neighboring counties. But all you can see really in that high transmission phase. This is that tracker for us, just showing you kind of where we're at this year compared to where we were last year. You know, we had a nice lull this summer, and we really saw that last summer. But unfortunately, as the summer, moved on, we just saw this huge upward spike, and that's really been the Delta variant. That's really almost 100% of the cases that are happening now are the Delta variant. This is super busy, but this is tracking across various age groups, and we're really seeing that same surge. It's been across really all age demographics. There are some that are higher contributors than others, but we're very much watching, especially our unvaccinated age groups, and those have had a huge trend up, which is again very different than what we saw last year. That there's been a much bigger increase in youth cases than the wild variant we were dealing with last year. Here you can see in the last week of data that we have here, there was a slight drop. We'll see if that actually is sustained or if it continues to climb. But we are still seeing disparities as we saw throughout the pandemic, and starting to grow again in our Hispanic Latinx community. So about 17% in the last couple of weeks of the population. And then here's kind of that breakdown across our county by municipality. So in the last week, about 31 cases in Longmont, 34% in Boulder. Still saw 49 cases in Lafayette, Louisville, and Superior, and then 64 cases throughout the county. So again, still seeing it across our county, and fairly consistent with the demographic or the population breakdown in our county, but something we'll continue to watch. Here's what I mentioned, what we've been seeing. We've been tracking all the variants throughout the pandemic, but here's just really in the last, in the 2021 phase, you can just see that huge swing that really in May into June, and then certainly July is when we pretty much saw it be almost entirely the Delta variant. And that also corresponds to a lot of those trends that you've seen. The increase in cases are now, here's a graph of our positivity, huge increase in positivity as this is really June into July and August. We've seen that going up and up from where we were seeing much lower percentages over the summer. So again, that Delta variant has been the driver for all this disease information. Similarly, the hospitalization trends have not been favorable. So again, the Delta variant has been causing more severe illness. So here's the tracking of the kind of national trends. And then you're going to see that it's very similar to the hospitalizations for COVID in Colorado as well. And it's important to note that this is just the COVID hospitalization. So any other reason why people might need an ICU bed is in addition to what's happening with COVID, which is why we're trying to put a focus on this component as a preventable piece of what is contributing to our hospitalizations. So we've talked for a long time now, at least in 2021, that we have the solution at hand, and it's vaccines. These are a lot of publications for anyone who needs additional resources and references on why we really want to focus on vaccines as a solution. But this will be part of the slide deck as Corinne records and posts things. The Delta variant, we've talked about breakthrough cases. This is just kind of defining in a more clinical terms of what a breakthrough case is, but really we're looking at people who've been vaccinated that are seeing illness from SARS-CoV related disease. So that's really what we're focused on, and it's why we need additional mitigation strategies and further increase in vaccines, because that we're seeing more and more folks. The Delta variant is causing more and more breakthrough, but we're still seeing the severity of illness is mostly focused with the unvaccinated. There's much less likely for severe illness from those that are vaccinated. And this is a very busy slide, but it'll be easier for you to see in the notes. But it's really showing that tracking of cases over time and what portion are from unvaccinated. There is definitely concern in our most recent couple weeks. We've seen more people that are vaccinated getting some hospitalization, and we've had some deaths in vaccinated. So we do know that this is still very serious, and we've got to have mitigation strategies, and people need to really take this seriously. So we have not seen, we know that this vaccine is not 100% effective. So that's again what one of the big drivers of the public health order is. And so we're going to continue to track all those, and we need to have additional strategies to support what we're doing. But we know that you still need to get a vaccine because it is still your best defense and our community's best defense. Here's a whole bunch of additional resources that will be part of the recording and information that goes out, but just want to make sure people have the best place to get data, where they can get information. We know that there's a lot of stuff floating around here, and we want to direct folks to the factual, accurate information so you can see that. I'm going to talk through where we're at and kind of, again, some of those drivers. Testing it is working. We're doing the increases in testing for folks that has really increased over the latter part of the summer, and continuing to partner on doing that. Our infection rates are increasing rapidly, so we're seeing more and more cases. It's putting more and more of a strain on our folks, but we are still doing contact investigation and that contact tracing case investigation work. So we're still doing that, but our capacity is being exceeded. So again, as those things rise, it's putting more and more strain on our system to manage it from our end. So we need those additional strategies. We've talked again about the Delta variant and the reinstitution of mask orders. And so here's just a cross section of, this is not something that Boulder is alone in looking at as a strategy. It's already been implemented in a number of places across the country. And I think you're going to see very strong correlations to places that have put things in place and lower overall rates of disease versus the ones that have not. And so that is very evident across our country. But there's other places that have even moved to steps like vaccine passports. So in order to be indoors in locations, you need to be vaccinated. So those are all just a quick smattering of kind of what's been going on. Now I really want to talk about what our public health order that's being proposed for the Board of Health this evening, what that looks like. So I do hope that what is passed is very much in alignment with what you're hearing today, so that you're prepped for it, because I don't know what the implementation date will be. It may be effective when they pass it tonight. So trying to give you, again, as much advance notice as I can. So again, it would be wearing a mask for all those that are older than 2, so who are not, and whether or not you're fully vaccinated. So that's going to be who it is, but we need everybody to wear a mask. It's certainly people who are unvaccinated are the highest risk, but again, we can have breakthrough cases as well as people that are vaccinated sharing this this virus. So we still need folks to stay protected. We know that we have folks that have weakened immune systems in our community, and even if they're fully vaccinated, they're still at higher risk. We know that their potential for getting immunity is not as great, even with a vaccine. We also need to really maximize this protection. The Delta variant is our current problem, and we know that there could be future variants. So we really need to do what we can to stop the spread and proliferation of this disease. And the CDC has been recommending this since July. So, you know, this is a policy that we've needed to get in place and have been working on that. So this is something that has been recommended across the country. I showed you this slide previously. So this is going to be our big metric as the public health order is put in place. So we will continue to look at those new cases as well as our positivity rate, and that will kind of trigger when we are in or out of risk and when the masks will be needed. And there'll be very clear caveats of when we would move forward or backward.
And before you go on, can you go back 2 slides? I think we need to clarify those 3 points because we're starting to get a lot of questions. So anybody who age 2,
I have another slide that's going to walk through all.
Oh, okay, good, because there were a lot of questions about this slide. So
yeah,
this is through it, then we're good.
This is all the CDC's recommendations. This is not the public health order specifically. I have a better slide for that. So
thank you. Sure. I just thought I'd stop all the questions coming in and to let them know.
Yeah, and not to tell you to not, you know, send in your questions, but hopefully I will answer them. And Corinne can certainly check them off as we go through the presentation, but hopefully I get to a lot of what you're going to be questioning, which is the nuances of the order. When do we and when do we not need to wear a mask? So I definitely will cover all that. So just wanting to show you over time, this is our positivity rate where we tracked. So you can see kind of those periods when we were in that in the higher and moderate levels of transmission. You know, our initial spikes, you know, we saw in the fall and end of last year, and then most of the year until we got into the summer of 2021. And then now you can see we're driving back up. And so again, this is our case counts that are driving that. So this is where we were. We did see that nice reduction. We got it down to very low transmission. And unfortunately, that's when the Delta variant arrived and has changed things dramatically. All right, so here's hopefully a lot of the questions you're getting are folks' questions that they have. So what the order is actually going to say. Anyone that is 2 and older in public indoor spaces, when we are in substantial or high transmission. So again, that's the CDC tracking on our case and positivity rates. And we are definitely in high transmission and have been for almost a month now. We'll need to wear a mask. The only exemptions are when it cannot be medically tolerated, or you're performing an activity with an exception in the order. And we'll spend time talking about what those exceptions are. And we want to provide flexibility to businesses who have chosen to implement a mandatory vaccine policy. It's being called the vaccine passport in other areas. So hopefully there will be a provision for folks, and I'll talk more about that as well later. So again, where does this apply? It's any public space. So really, it's going to be any indoor public space, which your private residences are not included, but all the retail stores, offices, any of the different sectors that were being broken out specifically, there's no more breaking out sectors. This will apply to all indoor spaces, but it does not apply to your private residence. You will need to have a sign, and it will need the sign will need to be very clear that masks are required. So the chamber did an awesome job of giving people a whole host of signs, especially for this last summer when all the orders went away, based on your comfort zone of putting things up. So some of those would no longer be viable. It isn't a mask optional. It's not mask based on vaccination status. So those kind of signs would no longer work. You need to have a sign that says masks are required indoors. And that will need to be posted at any of those public entrances. All right, so when would there be exceptions to this order? And this should be very consistent with the previous orders that we had. So if people are hearing impaired and it's needed for their understanding and communication, those would be exceptions. Basically, when you are a performer, that requires you to be 12 feet away from the other folks to be unmasked. So, and performer is very broad. So that can be really, I think, any setting where someone is performing, giving a speech, any of those types of settings where that person is doing that, they would need to have that additional space in order to be unmasked. Anytime you're alone, if you're the only one or members of the same household, those would be settings where people could be unmasked. So that has come up, we've had questions about a sauna, indoor sauna. If it is only a single person or the same household, could they be unmasked? And the answer is yes, they certainly can. And we would encourage that there not be any commingling of people in a household, because in those settings, they would not be wearing a mask. Similarly for swimming, if there's a need, anytime people are in the water, they do not need to be masked. That would include the instructors providing that assistance to young children who are just learning to swim. There were exemptions last time, and they continue for sports where wearing a mask is an impediment to the safety of the player, where that can be demonstrated, and then those would still be an exception. For our kind of eating facilities, so this would be your bars and restaurants. When they are seated and eating or drinking, they could have their mask off, but not any other time. That isn't a free-for-all that once you're in the door, you no longer need to be masked. It's only when you are seated and eating and drinking. Folks that are actively engaged in public safety, again, where there's a risk for them wearing that mask, would not have to. And then sort of those medical services, or if you're getting if there's a religious service where you get communion or things like that, where you need to remove your mask in order to have those services. Personal services like a facial, or going to the medical doctor like a dentist, where you're going to have to remove your mask to get those kind of services, the mask can be removed in those situations to receive those kind of services. Hopefully that answers a lot of the when you need to and when you don't. I know there'll still be a lot of those one-offs, and we'll still happily try to navigate that world, but that hopefully walked you through, how the mask order would work. Then this is the other component that if the board approves, there would be a voluntary program, again, not a requirement, but an opportunity for facilities who feel that the services or the activities they do would still be, they would prefer to not have masks. They can voluntarily look at creating a vaccination policy and program similar to, I think, what we've seen in other parts of the country, vaccine passports, where all of your staff, employees, contractors are vaccinated, as well as your guests, customers, members. So in the case of a gym, all of your staff, as well as all the gym members are vaccinated. They could apply to have an exemption to the mask order. We probably would still look at the situations on a case-by-case basis and may still want to see some additional strategies of either separations, or you have certain times of day when you're doing things, but this would be an opportunity for programs to propose. It could even be a single room, a single time of day, single activities that they're wanting to propose where they would have this mask exemption. They would need to have a vaccine program in place. And we will be fully developing that over the next month. We want to get a lot of input from our partners and folks that are thinking about this. We want to continue to talk to folks who've already done this and get an understanding of what works and what are problems. But we hope to have that as, if it is approved, that we would launch it by the end of September, hopefully. But a lot more to come based on whether that is approved or not. This is, again, getting more into some of those specifics. So you would design what you're looking to try to do. It would require our approval. And again, it may require some additional strategies. I think things that would be advantageous. We know we've talked to gyms who've really retrofitted their ventilation systems, added increased ways to filter virus particles, as well as other strategies that can even inactivate particles, adding additional distancing, similar to kind of some of the previous orders. Those are all additional strategies that can support getting those exemptions and approvals. Again, it's a voluntary program and it would require kind of that full vaccination. So for folks that are going to have lots of exemptions or don't think this would work for them, it is not something that we are requiring you to pursue. We would encourage it. We know vaccines are our best solution, so we want to encourage that in every situation possible. And it would require for folks that implement it to have proof of vaccination. You can't, it's not just a verification that, yes, I'm vaccinated. You would need to have some verification process. One way to do that is My Colorado. You can have your vaccine records uploaded, and that would be a visual way to approve and do that, in addition, obviously, to having your own vaccination card. But there would be a means for that proof that's needed for this program. All right. This is, don't need you to see the details on that slide, but I just want you to know that there are resources. This also does incorporate that isolation and quarantine are still required. So these are the reactive steps versus the proactive steps. So getting vaccinated, wearing masks, social distancing are all the ways that we prevent disease. Once you have illness and potentially outbreaks, now ill people must isolate, and those high-risk exposures must quarantine. So this will just walk through all those nuances when unfortunately disease occurs potentially in your business. So want to make sure folks are aware that that has not gone away. It has been there all the time and will be very clearly part of the order. So here again is the timeline. The board meets this evening and expect them to review all of these kind of components and make a final decision. Don't know what the effective date will be. It may be this evening, which is another reason why we wanted to have this webinar and have as much information in your hands. We'll definitely put out more information. There'll be a press release going out of the final order, so people will have all of that. But it's important for you to know that that's when the decision is coming. It's coming this evening. So that board meeting starts at 5 p.m. The order is going to stay in effect kind of until it is rescinded. And really how it's going to fluctuate is as we see our risk of transmission, if that does decrease from where we currently are, we're going to want to see that stabilize and know that it is a stable decrease before masks would not be required indoors. So the order won't be rescinded. It's going to just stay in place, but there will be that flexibility that if we're really not seeing the same level of risk in our community and that has been stabilized, then masks can be removed. And then unfortunately, if things escalate again, masks would go back in place. So there won't be a rescinding and reinstitution of the order. This same order will be the driver to do all of that. But we are concerned about, again, this fall and winter seeing continued increase. So we want it to be as stable for businesses so that it isn't fluctuating back and forth and you never know what's going on. Yet we do know that people don't necessarily want to wear masks. And if we see that the risk has diminished, we want to be able to let people get back to even more of their normal life. So that's how the order would work in moving forward or moving backward in the mask component. All right. That is the end of the slide deck. So now, Corinne, let's see how many questions didn't get answered. So
quite a few, actually. So let's start with just before we get to the order and the approved fully vaccinated facility program, let's talk a little bit about numbers. How are variants known? Is there testing for this? Where does the testing take place for the variants? And you can either stop sharing or keep sharing, or I think we might have to go back to a slide every now and then.
Yeah, I don't see the button to stop sharing, so
I will stop your sharing so people can see you.
Great. So yes, variant typing is happening. It isn't happening in necessarily every single source of testing. There are home tests that are happening. That is not going to get variant typed. The MACO sites, the sites that we have stood up as a county and several of the state sites across Colorado are doing variant typing. At this point, though, we're seeing 100% of the cases pretty much are the Delta variant. So even if the location that you got tested wasn't doing variant typing, we're very certain that it's the Delta variant. That is absolutely what is circulating right now. If you've traveled into somewhere else in the US, it's still very likely the Delta variant, but if you've done international travel, there certainly is possibility that you have another variant.
Like Lambda and Mu, some of the new ones that are being discovered in some other countries, correct?
Yes.
There was a question about those variants. Have we seen any Lambda or Mu variants in Colorado or in the United States?
Yeah, I don't have the exact answer. I think they have, but again, that's not what we're seeing right now in this surge. It's Delta.
But everybody's tracking the other variants too. We're concentrating on Delta, knowing the other variants are in some cases tracking to be a little bit more transmissible. So you're starting with the Delta, but people within the public health department are tracking other variants and they're spread throughout the country and in Colorado. Okay, so speaking of testing, the Stasio Fairgrounds were supposed to close this month as far as the testing goes. Is there an extension proposed there, or what's the plan? I know there's still testing up in Ed. There's testing in Longmont at a new location that's not the fairgrounds anymore, and we can send out that information. But the Stasio Fairgrounds, what's the status on that?
I know that we're still going to be looking at testing resources, whether those are still the locations. I don't think that they may not be. And, the fairgrounds isn't necessarily as accessible to all of our community as a location, but we will continue to make sure our website has all of the active locations. So as those change, either new ones are stood up or where people can get testing, we'll make sure that our website has all of those resources.
But the plan right now is to potentially extend the testing resources within our community, just the locations might change.
Yeah, so there's definitely a need and a focus on making sure there's still access to adequate testing.
Okay. All right, so someone just said that, on the CDPHE website, you can track variants. If you go to see, I can send out that as well. I sent a whole bunch of links for statistics sites. for individuals to be able to track the CDC numbers, those two metrics, as well as metro-wide, not just Boulder County metrics, including hospitalizations, ICU capacity, all of that, and then a link to some other areas. So there are 4 tracking the data links in the emails that I sent out, but we will see if there's any additional links that we need to add for future emails. So let's talk a little bit about the science behind wearing masks. We have quite a few questions about that. And you did show a lot of links about the science behind the vaccinations and why vaccinations are still very effective and why that's the #1 solution. Do we have some science and research behind why masks is that next step, or that will help prevent some of the spread?
Yes, there is. And the CDC definitely has a lot of information. There's also a lot of correlation that we're seeing even in these current surges to locations that have mask components in schools as well as in communities versus those that do not, and the level of transmission. So there's going to be, I think, even more coming out with Delta variant specific data. But we know that there is a difference between what kind of mask people wear, from a respirator down to some, very, thin type of cloth that people might be using. So there's definitely a variability in effectiveness from a respirator, which is the highest, to, just a self-made cloth mask. But we do see reduction in the overall exposure risk for those folks. And we know that folks that are vaccinated can still spread the disease as well. So there's, again, no risk for folks that are vaccinated to the rest of the community. They can still spread the disease as well. So having 2 masked individuals, in the same room, one who's vaccinated and one who's not, you're further reducing the risk to both parties when they're both masked.
So if we can get our hands on, maybe I can send out some of those links in the email. Don't search for them right now. We can do it afterwards, but we can send out some of that information or links to sites so that individuals can read some of those in addition to the vaccination links that you put out. So let's talk a little bit about the 2 metrics that you're using to track. There is no longer a dial at CDPHE, and those we're using really 3 metrics. 2 of those metrics still exist within the CDC tracker, which is the number of incidence cases per 100,000, and then the percent positivity, which is called something a little different on the CDC site. So to clarify, we're in the red right now, but mask order would be in effect if we're in red or orange, correct?
Correct.
So we'd have to be under 50 cases per 100,000 in order to be able to look at that at going into the yellow. We're still looking at colors. It's not the same dial, but we're still looking at colors. So our goal would be to get into the yellow, stay in the yellow and be sustained in the yellow. And then while the mask order is still in effect, we'd be able to take off masks in facilities because we're in a sustained yellow.
Correct.
Okay. What is the fear of the mix of these variants and flu right now? Some people are calling it a dual pandemic. I don't know. What is the fear of the flu coming in with as Delta is starting to spread?
Well, the risk is always an additional respiratory disease. So they're both prevented very much the same way. So it's important for folks to get their seasonal flu shot. You're limiting your indoor exposures is also going to limit your flu risk. Having a mask, is going to further reduce your flu transmission risk. So, the social distancing, having those spaces, that's going to further reduce that risk. What we saw last year was very little flu instance of disease, and it's because it's prevented very much in the same fashion. So that's, I think, going to be the concern to the healthcare system is, here's another disease that has the potential to hospitalize and can cause death. So that's the healthcare system as a whole is still one of those critical pieces that we're preserving. So we have to make sure that their system doesn't get overwhelmed. And so that was a lot of the dialogue last year because it had happened in other parts of the world. it is starting to happen in this country. It has not happened in Colorado, but there are systems that are overwhelmed in this country. So, people think that it cannot happen, and it absolutely can. And so it is the burden of all diseases. It's not just COVID, it's not just the flu, it's the culmination of everything that could require someone to be hospitalized and need an ICU bed. There are only so many ICU beds. So it isn't like they have 1,000 for COVID and 1,000 for heart attacks and 1,000 for strokes and on and on. They have the ICU beds. And when they are maxed out for whatever is causing them to be maxed out, they are now maxed out. In addition to the strains that we've talked about on the healthcare worker system. So they're seeing further and further difficulty in having enough staff to adequately deal with all the issues that they're dealing with. So there's a number of nuances that go into it, but that is the big concern that we have to make sure we can avoid.
So let's talk about some specifics behind the proposed mask order. Again, this is proposed. The Board of Health will be meeting tonight at 5 o'clock. It is a public meeting. One of the questions was, do we have a voice in this process? The Board of Health meeting, and I sent the link to the agenda in the email I sent out yesterday that includes the information on the Board of Health meeting. So the Board of Health meets tonight at 5 p.m. The agenda is in the email that I sent you. It's in a link in the very first paragraph and then under vaccinations as well. So if you'd like to have a voice, be at the table with the Board of Health, that is where that would be. I do have one person that keeps raising their hand. Because of the number of people on this call and the number of questions, I can't actually promote you to speaker at this time. If you have a big question, put it in the chat or the Q&A. So let's talk about 2 and older. That includes age 2, or is it 3?
2 and older.
So age 2 and older. So anybody younger than 2, so 23 months and younger, 23 months and 30 days doesn't have to wear a mask, but 24 months and above need to wear a mask. You talk about certain sports. Sorry, my puppy in the background is whining. You talk about certain sports, the potential exemptions for certain sports. Would this include hockey, for example, with all the masks that they wear indoors at a place like Sports Stable?
Only if, again, there's been a determination that there's a medical danger for wearing the mask. So so that would be the instance where a mask potentially could be exempted, but not necessarily across every sport.
Okay, so how will the impediment to safety of sports player be identified? How does a facility identify that? Could it be a rock climber who, as they're climbing up the rock, they don't feel safe wearing a mask? How is that impediment to safety of sports player going to be identified?
Yeah, that's a good question. And I, initially I would say if there is any kind of medical consultant for the programs that are already designed and they make that determination. And I know that was happening with some of the, organized sports through, CHASA and things like that. So I think that those are the kind of steps. Just someone saying they feel uncomfortable doing it is not going to be a reason for an exception. Okay.
So is there any distancing requirements in this order at this time?
There's not. Where that nuance could come in is for folks looking for mask exemptions. And again, depending on the setting. So a gym might be an example where having all exercise equipment right next to each other and unmasked people, even though they're vaccinated, that still would be a much higher risk because they're breathing harder. So it might still be a situation where they would need the unmasked vaccinated people to still be socially distant in the same room. But the order does not specify limitations on people or distancing requirements. Like for restaurants, the tables need to be 6 feet. For folks that aren't pursuing, vaccination programs, that would be very advisable because unmasked, unvaccinated people dining next to each other is very high risk.
Okay. So, but in the order itself, there are no spacing requirements, no capacity limits at this time. Those are last week when you showed the spectrum of different, preventative measures along the way, and then leading to more of the closures, capacity limitations, all of that. That's later down, but masking is still early in that process.
Correct. Yeah, we hope to not have to see that. So the more proactive folks can create safer environments, the better. That avoids those things from happening.
So I think there's some confusion around the term public, public facilities. So there's questions about, is this only for the public facing parts of a facility? And you define public as anybody from not the same family coming into a place other than a house, correct?
Yeah, so an office building, with only your staff, that's still, it is triggered. So it's not just where you're seeing clients or things like that. It's largely any indoor space except for private residences. So office spaces, manufacturing settings, grocery stores,
services,
personal
grocery
services.
stores, retail, restaurants, gyms, event settings, hospitality.
Everything.
All of those are considered public spaces. And it can't just be the public facing side of that business that has the mask. It's even the behind the house type jobs, or the office, or those are the types of questions we're getting.
Yeah.
So literally, unless you're in a room with four walls, or 3 walls and a door, 4 walls and a door, and you're alone, you have to wear a mask. Okay. So the performer question. So can you describe what the term performers means? And is it 12 feet between the performers, or 12 feet between the unmasked performers, or 12 feet between the performers and the audience, or both?
Yeah, that question's come up. So I think the final determination will be, on a lot of these, we're going to need the final order to see that. But that's what's being proposed is 12 feet. And I think clarifying, is it between performers as well? It definitely is between performers and the audience, but it may also include between individual performers. And then a performer, it isn't going to get into nuances of, this is considered a performer and this is not. It's really anybody who's in that role. So
this will impact things like plays, and and I know in the past they had a place in the order that said, under a certain number, or this is going to be a huge impact on performances if there is that spacing between the performers, especially ones that are already planned in current selling tickets for, or so forth. So I would maybe push that as a clarification that needs to be done sooner than later, because there's a lot of questions about that one.
And this is, again, an opportunity for folks to look at vaccination programs. So again, if the entire troop is vaccinated, that could be a situation where they would want to pursue that as an opportunity to say, we would like to be unmasked between all of our folks because we're all vaccinated. So those would be, again, things to encourage folks to look at.
So, but what would that require necessarily their guests to be, or just the performers on stage? Because you're basically saying fully vaccinated for the stage.
Again, for their group, all the audience would need to be vaccinated in those situations. Now, they could also encourage that. I know that has happened over this summer, that performances, in order to come and get a ticket, you had to be vaccinated. So those are additional steps that would make a lot of sense too.
Okay, so more performing questions coming in, but I think needs to be some clarification around while seated in food and beverage. So we have a lot of events and coming up where there's standing receptions, and they're drinking and they're eating while standing at a table, or just in the audience. Will they have to be seated in order to take off their mask while eating and drinking?
Yes.
So all of these, indoors, these networking type situations, they're going to need to be masked, and then they'll have to move the food and drink into a seated location.
Or move the activity outdoors.
Is that right now? And that's another question. Right now, there is no mask. There's not going to be a mask order for outdoors at this time, just recommendations.
Correct.
Okay. All right, that's bringing up even more questions. So you said that we don't know the implementation date. This could go into effect as soon as when this goes out. I do want to clarify with everybody out there that we've all pushed for a delayed delayed period for when this goes into effect. Cannot promise that will happen. There's a good chance it will go into effect if it's voted on and approved this evening. But we'll let you know as soon as we know when that is. And then the mask signage that we sent out, there is one that says masks are required. I also sent out the state signs that say masks are required, and I'll resend those out with the order details when we have it, and they're in English and Spanish. So we have both translations for everybody, and you can choose which masks which signs you would want to use.
I think there will be a link in the order to the mask resources as well.
Mm-hmm. Okay. So outdoor gatherings, right now, there's no mask order. We covered some of the certain sports. Okay, let's talk a little bit about personal services. We have a lot of estheticians, massage therapists, and and then hair people on the call. This would go back to the way it was with the personal services, where they where the actual customer will wear a cloth mask or a mask at all times, except during the service that requires the removal of the mask. But the actual therapist, esthetician, all of those need to stay masked the whole time, correct?
Correct.
Okay. Yes, people are very frustrated that they would possibly have less than 24 hours to make significant changes to policy and notify customers. That's why, we're trying to give as much information right now. Again, worst case scenario is the activation is, immediately following the meeting. Hope that there's a delayed, but it most likely will be the worst case scenario on that one. So one actual piece of clarification, if we could maybe ask the communications team on the testing site, if they could put whether or not they charge for testing at those sites that are listed on the Boulder County, maybe with a $ or some sort of symbol, so that people know if they charge. I answered the mask sign question. So, do you need to space out your flu shots and your vaccine shots?
No. So at this time, I know that other vaccines, not just flu or things, there initially was a separation in that changed over the summer, so that there is not a need to delay. Hopefully, folks, if you haven't gotten your COVID, get that immediately, because the flu vaccines are not quite as readily available yet.
Okay. I'm going to put a link to the Board of Health meeting agenda in the chat as requested by a couple people. So I'm going to do that right now. And so again, there's the Board of Health agenda meeting for tonight in PDF, and it has the information on the meeting. Let's go back to these questions. We have a lot of questions, so I'm going to try to put them together. The mask order, this is not the current mask order. The current mask order is currently for, childcare, camps, K through 12. This is the order that's being proposed to the Board of Health at 5 p.m. today. If it's voted on and approved, it would go into effect at the time in which they say it will go into effect. So people are clarifying. The masks would be required indoors for anyone 2 and older, regardless of your vaccination status, except
Correct.
in situations. That's a lot of the questions right there.
And the previous order is still in effect. So this order doesn't supersede or replace. So the child program, both in schools as well as outside of schools, is still in effect and remains unchanged.
And then again, the only times you could remove your mask are the ones that are listed in that list that you gave. And one of those is if you're alone in a closed room. And that's where that office situation comes in. That's where, if you're the only one in the building, those are the types of situations. Someone asked where we could download the mask signage. I'll resend. There is mask signage available on the CDPHE site. There's mask signage on the Boulder Chamber site. There's mask signage on the Boulder County site. But again, we'll send out those links again for people to get. The state has just the sign that Lane showed in English and Spanish, masks required, the basic sign, or if you want a little bit of a more community-based one, we can resend those. All right, bars. So in a bar, they can't stand at the bar, but they can sit at the bar and drink with a mask off at this time. But again, standing is not, it has to be seated at this time.
Yeah, if you're not seated, you would need to be masked.
How is public health going to help with enforcement, especially as businesses start to get pushback from customers or employees? How are they going to help with enforcement? Where does the enforcement lie on this?
Largely, it's going to lie on that effort of compliance, but there will be a fair bit that falls back to businesses. So in the order, it will say that you do need to refuse service to folks that are refusing to wear a mask. So if you're not doing that, if you're not putting up the signage, if you don't have your staff wearing masks, those will be some of those triggers for enforcement. Our approach is going to be very similar to what we did last year, and making sure everyone has the tools, doing these webinars, knows as much in advance as we can. That's why we did the webinar last week, kind of to preface that this public health order decision was coming this week. We initially thought it might be on Monday, but now that was pushed to Thursday. So we did get a delay, but unfortunately now I think the order and the meeting might all happen in the same day rather than the meeting and then some delay before it goes into effect. But I don't know. But yeah, so we want to make sure folks have the resources to be successful. So we will have a team of folks that are going to continue to play that role, but we will still receive the complaints that we get, and we will do, that triage and investigation. And anyone who's kind of really blatantly disregarding the order, that's where the enforcement will be focused.
Can you define outdoors for us?
So really, the only kind of confusing area is tents, I guess, or and that's really where you have, open sides basically, so that you're allowing for that that air to actually move through the space. So any enclosed tents would be considered an indoor space, so you would still need masking. Outside of that, it's really looking at the walls. So an overhead structure to protect from the rain would not trigger it to be an indoor space.
Okay. So again, what's the difference between people seated at a table versus standing around a table together? We're really going to require people to sit if they're convened at a table and standing.
The difference is the control of activity and motion throughout the space, and it's that creep. So I think even sitting at a table is a risk. There's no doubt about it. So every step further into that risk world is further jeopardizing whether we have to add more stringent recommendation or more stringent public health orders, and again, more disease in our community. So that's going to be the real cutoff is, yeah, as soon as people are no longer seated, they have to be masked. They have to have the mask on.
Okay. And then someone asked for the proposed order to be put in the chat. We don't have a copy of the proposed order at this time, so I'm not able to do that. Lane's going off the last version that he had, which is not the final, may not be the final version that the Board of Health sees. So how about dancing at indoor events? You can dance if you're wearing a mask, correct?
Yeah, I think the situation, like people that still want to have their weddings and things like that, those are also going to be good settings to look at an exemption. So everyone at the reception is going to be vaccinated. This is a one evening event, and they would like to have that mask exemption. Those are going to be ones that'll be fairly easy for us to review and approve. So there is still ways to do it, but again, yes, otherwise, if you don't go that route, then people would need to be masked.
So most of the questions we're asking right now are if a facility doesn't move forward with this approved fully vaccinated facility that won't even be available immediately. That's something that you're in the works on defining and helping figure out the process. So just to clarify, a lot of these answers are with the mask order, no approved fully vaccinated facility type situation at this time. So if you're in an office and your next coworker is 12 feet from you, you still have to wear your mask if you're in the same room.
Correct.
If you're at a conference table and everybody in that room is vaccinated, do you still have to wear your mask?
Yes.
Now, these are the types of businesses that if you're able to control, know that everybody's vaccinated, you have vaccination requirements or incentives and have 100%, and you are able to control people coming in being vaccinated as well. Those would be the type of facilities that would be optimal to apply for a approved fully vaccinated facility when it is available.
Correct. And that's again where you really feel the need to have the lack of masks. So it's still going to be more protective and safer, even if you have 100% vaccination, to still wear a mask in addition. So, but we know that vaccines are still our North Star for solving this issue. So we want to make sure that is being promoted above all else.
Okay, so if you're in an employee training session and you're doing it in outdoors, or you're a trainer and you're doing it outdoors and you're doing all this stuff outdoors, would they need to require masks, or is it just when they're indoors and doing those types of situations?
It's only indoors. It certainly could be encouraged, if there's going to be folks in very tight quarters outdoors, that there still is a risk there. So we would encourage it, but the order would not require it.
Okay, so even though they're an office, employer, even though they're technically an office employer, when they move outside and they're doing these things outside, that it's about the setting that they're in when they're doing these activities. Okay, what's the plans regionally? There were some concerns that Boulder County is some of the lower numbers on that chart you gave with the regional. We're up against Weld, we're up against Larimer, we're up against Adams, all of which are higher numbers. What's the talk about this kind of order going into effect in Denver and other of our regional partners?
There's definitely always ongoing dialogue. So at least within the metro area, there is even a special group of Metro Denver partners for health that meet multiple times a week to talk about what they're seeing, what the strategies are. So there's always ongoing dialogue. I think it's important for folks to always be aware that the county lines are in some cases imaginary lines. Some people work in one county, live in another county. We know we share school districts across county lines. So what's happening in other counties absolutely has an influence and impact on the disease in our county. So we still are urging and trying to see consistent approaches and more holistic approaches, not even in just the region, but across the state. So the state did take action this week in requiring kind of healthcare workers to be vaccinated. So there's still some efforts statewide to really look at how do we continue to prevent this, especially in the highest risk settings.
Okay, so you wouldn't be surprised to see some other counties moving in this direction, especially in that Metro Denver area in the future, especially as the cases go up and the hospitals become a little bit fuller.
Yeah,
there were a lot of comments that like in Longmont and Erie, you could just go across county line, and so businesses might lose out to the competition across the street because of the mask order, and that's a concern when it's not done on a regional basis.
Yeah, and the risk of disease for people deciding to go into those areas is obviously heavily increased too. So hopefully it actually has an ability to drive folks to where they know businesses are safer, and maybe can even increase the business for those folks.
Okay. I'm going to, there's a question about whether or not cities are expanding outdoor liquor licensing in the dining areas. That actually is each of the municipalities that's making those decisions, and I'm sure there will be information coming out pretty soon about the plans for those. That is not actually run out of Boulder County Public Health, but I know the conversations are happening within the municipalities. and should be prepared to hear something about that. So that some people have a lot of guests that claim medical exemptions to mask mandates. What is their role as role to confirm this? Do they need to confirm these exemptions?
Really, again, there's not a clear medical exemption, as far as for masking, so it would be the activity that they're trying to do that they cannot wear a mask. If they say I just can't wear a mask at all, versus when they're exercising or when they're trying to do something like that. But it is not their job to get the health records or anything like that. It would just be a matter of, if it's a restaurant, they have to do outdoor dining or they need to get carry out and those kind of things. So those reasonable accommodations for the type of service, but it doesn't give a free for all for folks to then be unmasked indoors.
In an office setting, can an employee remove their mask when they sit down to eat and drink in the kitchen and break areas?
Yes.
The recording of this will be shared. I'm going to try to share it as soon as I get it uploaded. If you don't get an email from me with the share, the link to the past recordings, as soon as it's uploaded, it's on the YouTube site for the Boulder Chamber. So you can watch it, and I tried to get this uploaded within an hour after the event that we have it. So it's always going to be on the YouTube site. Whether or not I send the link to that YouTube site may not be right away. All right. There's a question about cleaning and disinfecting common areas between each use, kitchens, conference rooms. Are there requirements around those, or are those still in the recommendations on how to continue to prevent the spread within your business? But there's not a requirement for those items unless they're required under their food safety license, correct?
Correct. Yeah, I think just proactive steps are still important for folks to look at. I know we had that question on saunas. So as you're going to have activities where people are unmasked, restaurants, good example, having those efforts between parties is obviously going to be really important to do. But the order is focused on masking.
Some specific questions. Lifeguards on a stand, would they be required to wear a mask if the pool is indoors?
Yes.
Yes. If you're in a bar with a band, can you dance?
Yes.
With a mask on. So dance, nobody's cutting off dancing. There's no physical requirement as far as distancing requirements, still a recommendation, but no requirement for distancing between people and tables, no capacity limitations. You can still do these activities, you just have to be masked. We're gonna, all right. Let's talk a little bit really quickly about the quarantine and the isolation requirements. On the link that I sent out this week, the quarantine and isolation link to the Boulder County Public Health site, there's actually a really good chart. And I don't mean to say actually like it's a surprise, but there's a really good chart that talks about, if vaccinated, if unvaccinated, what do you need to do for quarantine and isolation? If you have COVID, you have to isolate, regardless of whether you're vaccinated or not. But it runs you through kind of a flow chart type situation on how long, when, where, get tested, when's the optimal time to get tested. And I'm going to resend that because it's a graphic that is easier than anything we've ever sent out about quarantining and isolation. But again, quarantining and isolation is still a reactive piece, as you put it. You can correct me on any of these things, but I've been looking at all these charts and I'm like, oh, this is something that we should get out more. So I did send a link to it. Hopefully it's at the bottom of the email. It was a really long email, so I'll try to move it up next time. All right, so there's question as to, again, why this is Boulder County. Why can't municipalities be separated? Why is one city being punished for another? And what you did show, the chart that shows the incidences between the different municipalities, and it's pretty even between Boulder and Longmont, and then the L towns, and then you have the other parts of the county. Is there talk about independence, or are you still seeing it throughout the county and not just in the city of Boulder?
So our order is for Boulder County. It's not for the city of Boulder. So this is across the entire county. I would expect that some of the municipalities might put local orders in addition to the county order, but this applies to the entire county.
So we had that question a couple times, and the idea is that, you know, you're seeing incidences across the county, and it's actually pretty even between the two largest of the municipalities. We still have a lot of questions. So if you want to stick around, please stick around. We'll send out the recording. And then as soon as we know what the order details are, we will send that out along with mass signage that effectively goes in with that order. Okay, so really quickly, again, massage therapists, practitioners, all of those, even though they're providing a service where the person could potentially take off their mask, like, you know, a facial or a piercing on your lip, or, you know, those types of things, the practitioner still needs to wear the mask at all times, correct?
Yes.
And because the patron is taking off their mask, in the past there have been, you know, requirements of a face shield and some other protective gear. Are there requirements for additional protective gear, or is that something that's optional to the practitioner to do as extended safety?
It's just, those would be recommendations, but the order would not require those.
I will say, and somebody did mention in this, I've noticed that personal services haven't taken away, especially for the practitioners, throughout this whole time. They've been wearing masks through most of this last period, because you're in close contact with so many people. That is one industry that I have seen a lot more of continued mask usage. All right, so there's a couple questions about, this is going to severely impact some business again, events, facilities, gyms, you know, some of those that people have chosen to go someplace else. They have a competitor in another area where people choose to go. And there's a question about, you know, we're doing this at a time when we have higher revenues because we're going into the winter months. This might severely impact us, some of the plans we've made into the future. Are there any resources to help businesses during this time, now that they're going to be impacted again under this order? And I don't know if you can answer this today, or if this is something that we as an economic development and municipality group could put together, that list of resources. I did send out the list of ARPA grants, or the recovery grants that the state opened. But as far as additional resources, those are the ones we have right now. I don't know if you can answer that, or if that's in the planning phases, or if that's something we're going to need to talk about in our group maybe tomorrow, as far as getting more information about that stuff.
Yeah, I don't have any information on additional funding beyond what has already been shared.
Okay, so, all right, so there's a bunch of questions about the fully vaccinated facility, approved fully vaccinated. And again, this is still in development, but the idea would, the language would be put into the order to allow Boulder County to create a program like this in the coming weeks. So the order might just mention it, but the program wouldn't go into effect quite yet. And any business would be eligible, including restaurants. There are restaurants that are requiring vaccination proof to enter. So that's a yes. He's shaking his head. People that are listening to the recording can't see it.
Yes, yeah. Anybody is eligible, doesn't guarantee everyone would get an approval. So again, we would need to look at what is being proposed, what the risks are. So don't want to give the false expectation that as long as you want to do it, you're approved to do it. So there will definitely be an approval process and list of what is expected to see in the application, and build the whole portal for you to make that application.
But the question is, would, as a restaurant or a retailer or, you know, an office or a manufacturer, would I be eligible to apply if I'm able to meet the criteria and get approved?
Yeah, and I think the restaurants are a really good example of ones who, you know, have some exceptions already built into the order, but have then a huge increased risk and potential for outbreak and things like that. So those that have really pursued some of those proactive steps are helping ensure more of their viability. And I think I mentioned that confidence from customers. I think that's another way to actually help reassure and your customers to be more likely to give you that patronage, as they know when they come there, everybody else is going to be vaccinated.
Okay, we're gonna go to another question. I have an employee with a lung disease who can't wear a mask. Do I need to give an exemption, or would I be liable if I force her to wear a mask?
Yeah, I think it's looking at accommodations for your staff, where what role they play and where they, where there's opportunities to work remotely or things like that. So you can definitely, have that communication with us so we can kind of try to sort through the nuance of what you're dealing with.
And then Lane is not a lawyer, so he's not going to give legal advice, but next week's webinar we have is going to be on vaccination. So it's 12:30 next Thursday, and we're going to talk about vaccine mandates, policies, and those types of incentives, those types of programs. We will have somebody from Employers Council on there that's going to talk about the more legal side, the law, and could probably cover some of the legal side of the masking as well, because it's very similar to the vaccination side. So I do want to mention that webinar that we did secure somebody from Employers Council and potentially some other labor agencies to talk through some of those pieces, because none of us up here are lawyers, so, or can give legal counsel on those types of things. So when you ask, am I liable? That's not something that Lane can answer, or I can answer in a lot of cases. That's that caveat. All right, so last week there was talk about large outdoor events being masked, like football games. Is there any mention of that in this order?
Not in this order, but I think those are important things to look at as risks within our community, but that's not being proposed at this time.
We're not sure when this order, if this order is approved tonight at the Board of Health. There's always that caveat. If it's approved at the Board of Health meeting tonight and it goes into effect, there's not really an end date, but there are metrics by which, masks can be removed after sustained period within those metrics, which is under a certain number of cases per 100,000. So in that yellow on the CDC tracker. So it's not where you're going to be, oh, we're going to extend this another month, or, there's not an end date on it, but there are at least boundaries by which we can move up and down within the order, so that they can keep it in place. But then we, as a community, if our numbers go down, we could relinquish some of the mask requirements.
Yeah, and I think the tentative timeline for that reduction would be that we've seen 21 days of that stable decrease. So that gives that ability to then remove masks. So once we've seen and sustained that, and we're not looking that it's fluctuating back and forth, because we don't want today you wear a mask, tomorrow you don't, today you do, tomorrow you don't. That's not manageable on anybody.
We have a lot of requests for the research links for, mass effects of vaccination, boosters, additional shots. So we will, from the county, to provide some of those links for businesses to use. Maybe in the vaccination webinar, we could talk a little bit about some of the justifications and the language, and some of the resources that businesses can use when talking about vaccinations with others. But then I saw you write it down, that there is that request for additional, and as soon as we have some of those links, and or if it's on a website, we can send those out. What if an employee only works outside? Do they need to wear a mask on the patio at a bar?
No.
But when they come inside, they probably should have one on them, because when they come inside to use the facilities, or to come inside to close out for the evening, they'll need to wear a mask.
Yes.
Okay. And then someone said, I appreciate that your comment about that, I appreciate your response that people might support you if you're safe, but in a lot of cases, that's not the reality, especially when in the border areas, that this will affect businesses. And so just the knowledge that this is going to severely affect some businesses in their competitive stature. Okay, just to clarify, swim lessons are able to take place with an instructor, hands-on contact, regardless of indoor or outdoor settings. Why is there not a flu shot yet? We should be getting them by now, shouldn't we?
Usually they come out around September, October.
So, and then last year they had made a recommendation of like when to get it, and it was sometime, we started to actually push it on the webinars in like around of October. So those should be coming out soon. Okay, again, if you have a cocktail reception, it's indoor. They're not seated, they can't take off their masks. They're seated, they can. If it's outdoor, it's not covered under this order. There are some people scrambling right now to change their events. Let's just put it that way. Why are we no longer tracking hospitalizations? Because it seems like hospitals is an accurate representation of what's the real strain on the system in our community. And why are hospitalizations not that metric that's being tracked anymore?
It is being tracked. It's not one of the CDC transmission metrics, because again, it's the after fact. That's how many people already are ill. So we are still tracking it. It's just not the indicator of what level of transmission we're seeing. It's the severity of the transmission.
Okay, just to clarify, vaccinated individuals can still catch and transmit the disease. So even if, if they have the disease or they have symptoms, they should first be tested. Even if you're vaccinated, make sure you continue to test, as you've mentioned many times. But there are protocols within the quarantine and the isolation, and if you have a sick employee, what to do, that you should probably still follow even if they're vaccinated, correct?
Yes.
If you have symptoms. So if you have an employee come to you and say, I'm vaccinated, but I'm showing these symptoms, what should you do first?
You should exclude the employee if it's if their job is at all interacting with other employees or your customers or public. So, and then encourage them to be tested. And then depending on what the results are, they would need to isolate if they are positive, or otherwise wait till symptoms resolve.
And there's guidance on both Boulder County Public Health and the state site that I think I sent out yesterday again, and we'll continue to send these links out so they're readily available for you on what to do when you have a sick employee, whether they're vaccinated or not, what the quarantine piece is. But again, you've mentioned many times if someone's sick, they should probably stay home because the flu is not a great thing to pass along as well. Will there be a designation as to what type of mask or requirement as to what type of mask the public, anybody has to wear? Is it an N95, generic face covering? Is that in the order, or is it face covering?
It's face covering.
Do you believe that this is going to reduce the vaccinations in our community if we have a mask order in place?
No, I don't think so. And I'm certainly hopeful that with some of the other programs that we further increase our vaccination rates. So masks are not the solution. They are one of the strategies, but not a standalone strategy.
Okay. Somebody's asking for the vaccine tracking information between counties. That is the Metro Denver link I sent out yesterday under tracking the data. Again, I'm going to send all this stuff out again. I'll try to put it into the chat if I can, but there's still a lot of questions. So there's some questions about what if an employee refuses to get vaccinated, refuses to get a test, refuses to wear a mask. And those are some of those more HR legal questions in your case, right, Lane?
Yeah, I can't advise you on how you handle your personnel issues, but next week we'll definitely talk about vaccination policies and what kind of policies already have been implemented and how to go about doing some of those things, but I can't tell you how to handle those HR issues.
Yeah, and because we're bringing on Employers Council, they're going to talk a little bit about the EEOC, some of the ADA, some of those based on these incentives, mandates, all of those pieces and how it fits within those guidances. So that's why I want to make sure I had somebody that was willing to get some information on that on the webinar. Okay, so how do you get access to public health, Board of Health meetings in other counties? How could you find out about what they're doing in other counties and potentially get the agendas for other boards of health.
I think the web is probably still the best tool that all of the boards, I would expect, post their minutes from previous meetings as well as the agendas and when upcoming meetings will be. That's probably your best resource. That's how Boulder County Board of Health works, that all that information is posted. The signups that Corinne shared for how to get into, as well as if you wish to make public comment, there are sign up links for you to sign up to make that kind of comment. So, but that's my best thought of how you can find out.
So if I wanted to go to a Jeffco Board of Health meeting or just attend as a public citizen, I could go to Jeffco Public Health, and then there's probably a tab for Board of Health and talk about upcoming meetings and meeting minutes and access to those meetings. Same thing with Tri-County Public Health, Tri-County Health Department, which is Adams, Arapahoe, and Douglas. Denver has a health department. Weld has a health department. Larimer has a health department. So it would be on their health sites. Okay. All right, we got the grants question again. Again, we'll try to see if we can come up with a resource or information on anything that's available out there. Ooh, sorry, there's still a lot of questions. All right. Okay, so do the tracking numbers take into account the number of people that are in long-term care facilities who are not active with the public who are testing positive? Is that influencing the numbers or causing issues, increasing those numbers, in a way that doesn't really show the full picture of our community?
No, I don't think so. I mean, we're tracking not just the total number of cases, but we look very closely at the age of individuals. And so we're tracking all of those nuances. I had a slide that's super busy that had all of the different age demographics. And we are still seeing high incidence in older adults as well. The highest age group is 23, 24-year-olds. So that kind of age group. So it's variable. But we're looking at all of that. We've seen increases across all age demographics in the last month. So it is not exclusive to elderly folks.
And then the next question is, you mentioned something about the My Colorado app, and we actually sent this out in the Boulder Chamber's EV newsletter, and I'm going to try to send out the information, but it looks, it's like this, and then it allows you to put in your vaccine record, and then I don't want everybody to see my vaccine record, but it literally pulls up a copy of your vaccine record. You can put your driver's license in there, your car registration. It's the Colorado app that's a secure site for you to put all your documents, and they actually have a link to be able to put a vaccine record, and it's supposed to be accepted. So like I said, I took a picture of it, I have it in my phone, and then when I went and put it into this site, it actually created a vaccine card for me on that site. So it's the My Colorado app, and I will send out information about that. But it's your digital ID method that they have in Colorado. So it's not a vaccine. It's not like what New York's doing, but it's our Colorado version of that ability to keep your vaccine record on hand. All right, I'm going to, we still have quite a few questions about, the approved fully vaccinated facility. Again, you'll probably have more information as that develops, but the key is that the order, you're trying to get within an order, the ability to have some flexibility to be able to create a program like that. And that's what's about happening tonight. There is, questions about how do I check people's vaccines? So the My Colorado is an option for people to house it, but how do I personally check vaccine cards? And I know that a lot of associations across the state are moving towards ways to capture people's vaccinations or testing results and other ways as they start to require vaccinations. So maybe we'll put together a list of resources that others are using along the way. At this point, I'm going to say a lot of these questions I think were covered. Some of them are very detailed and specific to a specific case. And if your question wasn't answered because we're a half hour over the time, please email me and we'll see if we can get that question answered. Again, the final order, this wasn't the final order. The final order is what goes to the Board of Health, and we'll know more details. But Lane gave you the last version he saw as far as trying to get you as prepared as possible. This, again, this isn't good news for a lot of businesses. It's a approach that Boulder County and some other counties are discussing to help mitigate the spread of this Delta variant, so that hopefully we don't have to move along that spectrum to other pieces. So again, we have a webinar next week at 12:30. It is about vaccinations and vaccination programs, mandates, incentives, employee programs, those types of things. If we have some questions at the end about the mask order, we might be able to answer a few of those. But at this time, that particular webinar is going to be about vaccinations. As soon as we have the information, we'll send it out. I appreciate everybody attending. I know there are a lot of people that are pretty frustrated on today's call, or it's upsetting news in a lot of ways, but because we're moving backwards. But we hope that as we work together as a community and continue to do some of these early mitigation methods, we can not have to move to the more severe ones later on. That's our hope. So if you have any questions, let us know. Otherwise, I will continue to send out these links. I'll continue to send out the information as we have it. And we'll continue to give you the information that we have, and the graphics that might work for your commute, for your business, that will help you make those decisions you need to make. Mask signs, mask order, and additional information will go out as soon as we have it. Thank you. Thanks, Lane.
Thank you all.